So let's talk about your role in promoting skin integrity. So as a direct caregiver, you, the nurse aide, will be the key team member in the prevention of pressure ulcers. These are also called bed sores or decubitus ulcers. So pressure ulcers are caused by pressure on an area of skin and it interferes with circulation. For example, when a car rolls across a garden hose hooked up to water, the hose will flatten and the water won't come through it. Therefore, when you put pressure on something, it interferes with the continuation. So what does circulation provide for the tissues? So pressure ulcers occur where bones come close to the skin surface or bony prominences. So a bony prominence could be something like your heel, your ankle, your knees, your elbows, toes, hips, shoulders, the spine, especially the tailbone area, the ears, the cheeks, the collarbone, and the back of the head. Pressure ulcers can develop anywhere an area of the body rubs together, and moisture collects, especially in obese residents. It can also occur under the breasts, between folds of the abdomen, between the crease of the buttocks, between the thighs. So again, remember, an ounce of prevention is worth a pound of cure. Keep skin clean and dry. Keep the linen dry and free of wrinkles and objects that cause pressure to the skin. Make sure urine and feces are away from the skin as soon as possible. Reposition residents at least every 2 hours and make sure the clothing and shoes do not bind or constrict. We always pat skin dry when we bathe. We never scrub or rub. Encourage adequate nutrition and fluids, and this is different for everybody. Massage healthy skin and tissue around the areas. Use circular light strokes to increase circulation. Use little or no pressure on bony areas like the elbows. Don't massage a white, red, or purple area or put any pressure on it. Make sure you're careful when you transfer residents. Don't avoid pulling them or tearing their fragile skin. Make sure your jewelry is not damaged, because this can be a knife and actually cut someone. So take your jewelry off. Keep your fingernails short. This is more of a safe look than this. So you need to make sure that you report any change in skin condition immediately. So some of the devices that we use as preventative measures for pressure ulcers are bed cradles, heel and elbow protectors, flotation pads or cushions, pillows, water beds, alternating pressure mattresses, egg crate mattresses. So let's talk about the stages of tissue breakdown and treatment. So stage 1 ulcer is a red, darkened, or non-blanchable skin which is still present 30 minutes after pressure is relieved. Stage 1, we need to position off the area and report. Do not massage. Observe the area every 2 hours and report any changes. Stage 2. With stage 2, you have stage 1 plus the addition of blister-like lesions, and the skin may be broken. We need to position the resident off the area at all times. Report a need for dressing changes, and we need to report this. Report any odor, drainage, or change in color or size. Stage 3, the skin tissue is destroyed and the fatty tissue may be involved. Infection and eschar, which is a scab, may result. Make sure we continue our preventative practice and report any changes. Stage 4 involves the skin, fatty tissue is destroyed, and then the muscle and the bone become involved. Report any signs of systemic infection that include but aren't limited to wound odor, pain, temperature, and with the temperature, confusion. So let's talk about positioning. So positioning assists with examinations, assists with procedures, and it prevents pressure on skin for prolonged periods of time. The dorsal recumbent position, and you can actually go and look at the link, is flat on the back, The knees are slightly separated and flexed, and the feet are flat on the bed. The horizontal recumbent position, you are supine, flat on your back, legs are slightly separated, and they are extended. The prone position, you are flat on your abdomen, your head is turned to the side, your arms are at your sides or flexed on either side of the head. The side lying position, you're positioned on either side, head is in straight line with the spine, pillows are used to support the head, back, arm, and leg. The lateral position, you're positioned on either side, the bottom arm is extended behind the back, the top arm is flexed in front of the body, and the top leg is slightly flexed. A 30-degree lateral reclined position, the hips are rotated 30 degrees, a pillow is between the knees, the pillow is placed under the arm for comfort and to relieve pressure on the elbow. Pressure is relieved from the sacrum and the hip. Fowler's position, sitting position in bed with the head elevated, 45 to 60 degree angle, knees are slightly flexed. This position will cause pressure on the sacrum and the buttocks. Sims position, you are positioned on your left side, your left arm is extended behind your body, the right arm is flexed in front of the body, the right leg is flexed towards the abdomen, and this is actually used for enema administration. So the Sims position is the best position for enemas. So turning, moving, positioning, and lifting. Good body mechanics are necessary. It prevents injury to the resident. It protects you from injury. It allows for good body alignment and promotes comfort for your resident. Things to consider is get help if you need help. Receive directions from your supervisor regarding any restrictions for positioning or movement. Protect and secure any special equipment being used by the resident prior to movement, such as drainage tubes, Foley tubes, G-tubes, PEG tubes. Elevate the bed to comfortable working level for you. Protect skin from friction. We always roll residents when possible. Lift with assistance and prevent sliding, and we always use a turn sheet. Postural supports are used as directed, which are rolled blankets, pillows, rolled towels, footboards, and bed crates. Reposition residents at least every 2 hours or as directed. This eliminates pressure on bony areas, provides comfort, exercises muscles and moves the joints, and it stimulates circulation. Coordinate lifting and moving. We move on certain count, usually on the count of 3. Gain the cooperation of the resident if they're able, and have the residents help as much as possible. Use transfer belts or gait belts when appropriate, and when in doubt, always ask for help. So when we reposition in a chair or a wheelchair, we do this to promote comfort, reduce pressure on body parts, increase circulation, and exercise the joints. It also promotes muscle tone. Body is kept in good alignment with the head in straight line with the spine. Plastic or vinyl surface of the chair is covered with use of pressure relieving cushions if preferred. Pillows or soft blankets are also utilized for support. The feet rest on the floor or footrest of the wheelchair. The hips are positioned well in the back, and weight shifting is utilized in between repositioning. Why do you think we would shift weight? So other things that we do to promote skin integrity. We can apply non-sterile dressings. Is covering applied to the wound or injured body part where slight risk of infection or re-injury. Materials come in various types: gauze pads, band-aids, compresses. So warm and cold therapy requires a physician's order for the type of therapy and length of time for the application. Warmth dilates blood vessels, which increases blood supply to the area, brings oxygen and nutrients for healing. Fluids are also absorbed and the muscles relax, and pain can be relieved. Cold constricts blood vessels, decreases the blood supply, prevents swelling, controls bleeding, numbs the skin by reducing pain, and reduces body temperature. If it's a dry cold, water does not touch the skin. We use ice bags, ice caps, ice collars, and disposable ice packs. Moist cold water can touch the skin. Compressions, localized applications, soaks the body part is immersed in water, and a cool sponge bath. So dry warmth is like a heating pad with warm circulating water. A moist compress can be a soak or a sitz bath. Use bath thermometers to measure temperature of moist heat solutions, and don't operate any equipment you've not been trained to use. The temperature should never be more than 105 degrees for warm therapy. Cold therapy, apply ice with metal or plastic lids away from the skin as this can stick and pull. Cover ice caps, bags, and collars prior to applying. Check the skin frequently and report any complications, and never leave the ice therapy or heat therapy in place longer. So your skin is the body's first line of defense against disease, so we need to make sure we maintain the integrity of the skin.